Hello guys, today we're gonna talk about some hints in sacroiliac subluxation, but first of all we must really consider that subluxation is not the displaced break on the wall, but a pattern of neurophysiological joints function. And this dysfunction would occur between the sacrum bone, this is the sacrum bone, and innominatum. And the innominatum bone is really the fusion of three bones, actually. And this joint, sacroiliac joint, will have 8 patterns of restriction of movement that we call subluxations. And these 8 patterns will be divided in 4 pure listings and 4 composed listings. So let's talk about some findings that may occur and help in the clinical assessment of our patients. The reference for all subluxation in sacroiliac joint is the PSIS. And the PSIS is a structure that belongs to the innominatum bone, and this will name all the subluxation in sacroiliac joint. And this subluxation we now call listing. And the first listing we're going to study is the PI listing, when the PSIS is fixed down and there is a difficulty for the patient in active or passive movement to go up to AS position, like this. The PI will be like this, and there is a restriction of movement to go anterior superiorly. And the second pure movement, the second pure listing or restriction is the AS listing, when the innominatum bone, instead of being rocked posterior inferiorly, will be rocked anterior superiorly, and there is a restriction to go posterior inferiorly. This is AS listing. And the third listing is IN listing, when the PSIS will be fixed inward and there will be a difficulty to go externally. The fourth and the last pure listing is this external listing, often associated with a twisted sacrum that made difficulty to go PSIS inward. Well, this is all the pure listing, but we have 4 composed listings. That is association with the 4 pure listings that will bring 4 listings. And the first of all, I'd like to say that there's a group of classification of these listings. Hello colleagues, I'd like to explain to you how important is visualization and static palpation, and how it can bring some very important information that can do some correlation with some listings. For example, when I have a PI listing, we have a closure of the sacroiliac joint inferiorly, because the innominatum bone is rocked posteriorly. And then there is an aperture, an open wedge here in superior part of the joint. And then in this part, in this side, you will find edema in palpation, a tachy area with pain and edema. And then this will be a good finding to perceive that really is PI dysfunction. When you have AS, anterior superior dysfunction of the sacroiliac joint, you have a closure in the superior part of the sacroiliac joint, and it will be an open wedge here in the inferior part of sacroiliac joint that will be fitted by edema and also pain. And when you have an IM listing, the entire joint will be closed posteriorly and open anteriorly, and then the edema will be anteriorly and will not be perceived by the examiners. And then we can just ask the patient about groin pain or anterior pain in the sacroiliac joint. That will be a very important sign or finding for correlate with IM listing. And when you have finally the last EX listing, we perceive on EX a difficulty to go inward. PSIS will go difficult to move inward. In this situation, we have a closure in the anterior part of the ilium, in the sacroiliac joint. Innominatum and sacrum will be closed anteriorly, and then it will be fully open wedge here in the posterior part, and edema will be found in all the posterior part of sacroiliac joint, and also with tachy area and also pain. And then this will be a very good finding. And when the EX is combined with AS, we have much more pain and edema. Some patients may experience in very acute or chronic states pain or discomfort and lack of mobility when going from the situation of sitting to extending. This due to the sitting when they have a PI position and going to anterior superior when standing, and against two when going to the standing position and going for sitting position in some state where chronic there is a lot of discomfort and lack of mobility, and in acute phase a lot of sharp pain. How I talked to you before, there is 8 types of subluxation in sacroiliac joint, and 4 types. First types I already told to you is pure listings, and the other 4 listings are considered composed, and these composed listings are divided in 2 groups. The first group is marriage group. Why is called marriage? It's called marriage because this combination of restrictions brings the same effect and the same influence in the femoral head line. It's a line that passes over the femoral head, and this is called PIEX or ASIN. And all these groups of listings brings the same effect in femoral head line, even in correction or in subluxation, putting up or putting down. And the other group is called divorce listing. Divorce listing is a combination of subluxations that have different effect in the femoral head line. And then we call this PIIN or ASEX. And this will make a competition, depending on the degree of subluxation, will impact differently, and maybe in some cases, if there is the same degree of subluxation, even with a dysfunction will make the femoral head line be aligned because may have a compensation. Or if the number is different, we'll have we need to calculate the degree of correction to establish the impact in the femoral head line.